when a private company decides to act on its ever-changing situation, I can understand that.
Mm.
We spoke in the past about how a company's financial situation ebbs and flows like the tides.
Yeah.
And so they have to take the necessary measures to either increase production or reduce costs.
Mm.
But when it comes to the NHS, we need to look a little closer. After all, it is mostly public money financing the trusts dotted around the country, and they aren't supposed to be making a profit.
Mm.
But with middle managers galore sucking up a good part of the finances, trusts across the UK have decided to reduce costs. Now, one would have thought that with the help of artificial intelligence and modern technology, that costs could have been saved by removing one or two of these fat cats. Well, it seems that the white collar workers in the offices are going to save their own by reducing costs, getting rid of what amounts to be frontline staff. 21,000 of them over the next couple of years. So that means nurses, auxiliary staff, clinical staff, and some agency staff, you know, those people who work with the public directly. It looks like the NHS trusts are going to just be administrative centres and very little caregiving will take place. Unison, the largest nurses' unions, received a Freedom of Information request about the plan and is stunned. Helga Pike, one of the union reps, said cutting thousands of NHS jobs when staff are already stretched to the limit is the wrong answer. She went on, the public is all too aware how understaffing is a major problem, so they'll be rightly alarmed when the situation's getting worse. A Department of Health spokesperson said that the cuts should only be seen in agency staff, which is extremely expensive. Let's see if the agency lobby will keep their contracts over the next 24 months.
Okay.
1,000 jobs to go in the NHS trusts across the country, up to 2028. There you have it.
Yep. Right. Okay. Yeah, you're quite right that the NHS. Yeah, I mean, having worked at a nationalised industry in the past, yeah, there is a different attitude when you work within these organisations than if you work for a private organisation. Certainly, I mean, I've seen both sides to the coin, as it were. And yeah, even as an individual, and I will say, whenever I've used the NHS in the UK, the frontline staff, as you say, have always been professional, be it the receptionist at the hospital desk, through to the triage, through to the medical staff and everyone else, have been very, very helpful. It's actually quite interesting because they spent some time with me because I had a problem with my leg, and yeah, to be quite honest, they were worried I had a thrombosis. It turned out to be a thrombolina, which is not
Sounds like a fairy tale.
yeah.
Thrombolyne.
Yeah, a thrombolina, probably someone will correct me. Yeah, we've had the ailment, yeah, but it doesn't mean I remember it. I'd sooner not have it again. Yeah, but yeah, it's quite another funny story around that. But yeah, I was trying to teach the Brazilians how to play football just before I went back to the UK, and I injured my leg doing it, and yeah, could have had serious implications there. But it was but yeah, excellent thing. And actually, it's quite funny because I was sitting down didn't have a lot of time. I don't think we sat down and had a conversation. She was that, yeah, they like to know a bit about you. You're from Brazil. Yeah, well, I'm not from Brazil. I live there. Yeah, I'm just in the UK. Whatever reason I was there. And yeah, they asked me about comparisons about it. I said, well, the NHS, in fairness to Brazil, is still a lot better. But this is going back to 2017, 2018 time. Yeah. I've since heard the horror stories since then. Is my experience there would possibly not be quite the same as it was then. Yeah. I mean, I've had experience of the health system in Brazil, and hey, Brazilians are shocked when I'm actually quite satisfied. Yeah. Got there, got seen, saw a medical person, got my problem resolved. That's all I want. Yeah. I don't care if it's in a nice, shiny new place, or there is a little bit of flaky paint on the wall. Yeah. Um, Now, as to staffing levels, yes, we all know it's always going to be the problem in public sector working is you get a manager. They need two assistants. Yeah, because they might have to actually work 5 days a week. I'm probably going to get in trouble for this. And then those assistants need two assistants as well, because they might have to work 3 days a week if they don't have them. Yeah. And so it goes on. It's empire building, or call it else whatever you need. Yeah.
Yeah,
Um,
not normally if it's a public nationalized company, they're normally very bloated.
They are. That's what I mean, and this is what I'm saying is that's what happens with public companies and places. They have a budget, and even to the point, it gets towards the end of the year, and they've got money left over in the budget, and you're told to blow it.
Spend it. Yeah,
Yeah. Otherwise, you're going to lose it next year.
that's right.
There's all these tricks that go on. I mean, I don't want to see anyone out of work if you're doing a meaningful job. Um, if you're a good administrator, even if you're able to keep things running smoothly. The problem is with life, if you get a good administrator who's keeping things running smoothly, and nobody thinks they actually do anything. Yeah. I've encountered this where I've managed to keep things running and a department ticking over to the point nobody actually knew what I did. They got rid of me, moved me on, and then wanted me to come back. Because they realized exactly what I was doing. And it wasn't I was empire building. I was just doing things, the odd little things to keep things moving in the background, as it were. And I knew where everything was, and I knew all the systems and everything else. Yeah. And this is when I was working there years ago, and I realized that where the UK was heading, to be quite honest. And I'm going to be honest. Yeah, everything is so bloated in the UK. It's probably been like it for 40 years now. That there was the arguments. It's what Thatcher did in the 1980s. Thatcher tried to streamline the NHS and other public sector entities. You know, to the point is you have people go around. What do you do? Not a lot. What do you do? I help him. And this was for going on. Again, it's interesting you mentioned the unions, because remember in the 80s, if you tried to sack someone, the unions would be down your throat, disregards whatever that person was doing. And it was it was always a problem to get rid of anyone. That should change the laws a bit. Yeah. If you're actually working hard trying to do something, of course you should have a job. Like I said, if you're a good administrator, if you're a good doctor, a good nurse, it goes without saying, you should be secure. You can argue about scale of pay. And the end result is all people want is to be able to get an appointment if they need one. Yeah,
of course.
Go there. I mean, we used to have our own GPs. That's all gone by the wayside from what I could tell now in the UK. As you sort of said, now you go to a central point where you won't necessarily have a family doctor. You'll have who's ever available. Yeah.
That is what they're wanting to implement. It's something similar to here.
Yeah.
Something similar to here in Brazil, where you go to a local clinic, a community clinic, and then they'll refer you to somebody else.
Yeah.
And then you go to the next person, and you go on to, or they refer you to do your exam, get your examinations and your tests and things like that.
Yeah, I mean,
which here, I'll be quite honest, here using the SUS here is
yeah,
excellent,
yeah,
excellent.
exactly. Yeah, yeah. I mean, yeah, I mean, I don't bother with health insurance here. I quite happily use the SUS for minor things. I mean, obviously, if there's, yeah, yeah. Or yeah, even not so minor things. Yeah, I'll be quite happy to go to a SUS and get dealt with. I've seen one of my family members, or a few people I know, like you say, get yourself included, get involved in the SUS and get seen. As the NHS, yeah, as it should be. I mean, in the UK, they've spent a lot of money on this big all seeing, all dancing database. It doesn't matter where you go in the country, your records are there on a supposedly secure system. Yeah,
Well, size of the UK, the size of the UK is not all that much bigger than this state where we
yeah,
live here.
yeah. So yeah, okay, you
So,
could do it. But I'm just we're talking about the UK there, and everyone's records are and the age records are on there. I think
as
mine
they
are.
are, funnily enough, as they are here,
Mm,
as the on a state level,
yeah, yes,
on
yeah,
state level, it's all when you go on the SUS, it's the state
mm,
state level that treats you.
yeah. You put your NI number in or whatever number you've
That's
got,
right.
and you've got your identity card here.
That's
Yes,
right.
I said the dirty words of being from the UK. Here we carry an identity card. Yeah.
Mm.
I must admit, it's a dumb card. It doesn't have a lot of info, but I find it very useful to prove,
Yeah.
if I get stopped anything or
But coming back to the plot, if the
yeah.
UK is wanting to set up these clinics,
Mm-hmm.
these local clinics,
Mm-hmm.
they're going to need to staff them. But like they seem to be going against the grain because they want to get rid of 21,000 frontline people,
Mm,
right? But they're wanting to expand by having these clinics. And one would assume that the infrastructure that the NHS has now
mm,
is is large enough to cater for the population. It's just
yeah.
it just needs to be streamlined.
Well, this,
So if you're going to add to that,
mm,
then you shouldn't really need to take away people. On the contrary, you should add people
well,
to
or yeah, offer people something. I mean, some people might end up closer to home or something in these. Like, yeah, well, okay, you're a good receptionist here, or you're a good administrator. How would you like to have a new challenge? We'll give you your own your
yeah.
own your own place to
Yep.
administrate. Um, Hopefully that's what will happen. So when I mean, yeah, I see various different figures. Now, I've just thought of something else, a slightly different thing, because we're talking private and public sector. In the private sector, I was reading this week, and just to prove it's sort of connected here. There's a bank in the UK called Barclays Bank. I think they're global. They closed down a majority, if not all of their branches. Yeah.
They start to open them up again.
Yeah. Because people, yeah. Uh, I mean, okay, it's a slightly different thing. I mean, yeah, that's it. The NHS has an excellent website that you can go on and the 111 system and all that. They tried to implement that with banking. And let's be honest, even people like me who are a little bit quite computer literate, I like to think like, yeah, I can do things, and I've got someone under 25 in their house who can come and help me as well. Like you have to ask your son, how do you do this? Yeah, and we can work through it, even mobile phone. But yeah, there are occasions when you need to go and sit down in front of a person, and like with the NHS, with catching somebody who might not be ill, or God forbid, some physical abuse that a person might be suffering, that somebody might be able to pick up in a face to face. When you're talking about banking, again, I'm applying the engineering logic here, you can see fraud or something, potential fraud or something that's not quite right, or somebody's not understood something properly. Yeah. Which is what you can do with human interaction, which even with the best AI systems as stand, and probably for the next 20 years in the future, because AI is failing all over the place with different things, the more you read. Yeah. I mean, it can't even produce a hand with the correct amount of fingers on it at the moment. Yeah. Um, let alone perform an operation, this person has 7 fingers, um, but yeah, I'm joking a bit. But yeah, again, human interaction is everything. We are a species, like dogs, cats, and anyone else who need it, who need interaction with people. And it might be okay. You could talk technology. Is there are some services now that okay, you and I are about 12 kilometers apart. We're having a meeting. Yeah. You could be a doctor. I could be a patient. Yeah. Can you hold your hand up? Can you show me? And you could probably do something like that. Yeah.
Well, I'll tell you. The other day I went to have an electrocardiogram.
Mhm.
Right now, the electrocardiogram is done here,
Yeah.
right? But who receives the results of the electrocardiogram are in Bahia,
Yeah.
in a couple of states down.
Mm.
So all the little pulses that they're detecting on your heart and
Yeah.
and all this, they're sent all the way down to Bahia,
Mm.
and then Bahia sends back the results.
Yeah. Yes.
That to me it's
Well, it,
phenomenal.
I mean, yeah, it's applying the technology in a very sensible way. And I mean, Bahia is a little bit more central to Brazil as well. That probably happens from a situation in Rio as well. It could be a central point for that place in Brazil. I mean, yeah. And again, you get a central hub for places. They're geared up to it. It comes
Yeah,
in.
but, I mean that way you don't need a cardiologist
Mm.
in every post. You just
Yeah.
need somebody, a nurse,
Mm.
to stick the things on you
Yeah.
and do the reading and
Mm.
send it to somebody who is a cardiologist.
Yeah.
You know, uh, because
Yeah.
each local surgery is not going to have back to back complaints about the heart.
No. No. I mean,
Yeah.
this is it. Why would you? Yeah. I mean, this is it. It's specialism. I mean, and yes, yeah. I think they
But
used to.
that's what I mean about that's when I said about the artificial intelligence. That's what I meant about having to reduce costs.
Yeah. I mean, you can have um AI look at your pulsing, go bang, 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 bang. Then it's still, I mean, the thing is with AI, it's all about accountability as well. You can't say,
No, I'm
well,
not. No, no, no.
yeah,
I'm not saying that AI
if
should
the answer, but yeah,
diagnose. But what
yeah,
I'm trying to get at is using the communication, the
yeah,
internet,
yeah,
and this sort of thing that somebody, a real person,
that's what I mean.
can
Yeah,
receive all the data and
yeah,
can return with a diagnosis.
exactly.
So
Yeah,
instead of paying 20 people dotted around,
yeah,
20 cardiologists
yeah,
dotted around, you can employ perhaps 4 or 5
yeah. I mean,
to do the same thing.
yeah, I mean that they'll be, yeah, they'll be there. I mean, if you need a second opinion, you've already got one in situation there. Yeah, because
Yeah,
doctors do that as well. Well, okay, or it might be the doctors themselves will go, I've just done this. Can you just check it? Yeah, they might have the procedure to do that themselves. Yeah, just make sure I'm not about to tell somebody that they've got a clean bit of health and they're going to walk out the place or have a problem. I mean, okay, nothing's guaranteed, but yeah, yeah. I mean, Brazil is actually quite good at using technology. I mean, it's got some of the most sophisticated banking systems here
yeah.
and other systems. I mean, where we're based near us, you've got Porta Digital, which is one of the main hubs for digital research and development, soon to be possibly in the world. Yeah. Yeah, just put a plug there, for my local town. Yeah, Porta Digital. I might flash that up as well. Yeah, I mean, yeah, correct use of technology and everything else. It's like you say, it's going to be interesting to see how it goes. Now, I know all governments talk about employing technology. The interesting thing is we're relying on the US to bring in this technology. I mean, a lot of the technology probably used in Brazil has originated from the US. I mean, we've got some homegrown tech here. As like I said, we're sitting on one near place now, possibly though with probably doing contract work for other countries, although I know of different homegrown projects within Brazil that are being worked on. It is a yeah. I mean, this is how we can use tech to help us. It's like you say, as we used to call them centers of excellence. We didn't mean they're excellent places, but yeah, a one main hub that had your specialists all there, which unions used to hate for the reasons you've just
Yeah,
said.
of course.
Yeah, is that you
Mhm.
do reduce staffing. Now, as you said, ultimately you want to walk into a centre and be able to speak to a human being. You're going to have concerns if somebody's telling you bad news or a potentially bad news, or that you might have to have an operation. That's still done best face to face. Not even as we're talking now, somebody there who can sort of, you know, oh my God, yeah, who can go and put, if you like, touch your shoulder and go, yeah, 'cause you're not allowed to hug people, are you now? Touch your shoulder and say, okay, physical contact, yeah, okay, we're going to go through this together. I'll explain things if you, yeah. Um, so yeah, we can't go all totally tech on it. Yeah, we're still going to need some human people or people that are trained how to deal with trauma with people. I mean, being
Yep.
told you've been through the experience, being told you've got a heart condition is a traumatic thing, um, and or any medical condition. Yeah, we've gone away from the original thing. Yeah, I mean, and this again.
I just want to give a conclusion to
Yeah, yeah, okay,
this
yeah,
little 30 minutes
yeah.
and just say, brace yourself, people, because over the next 2 years, 21,000 people are not going to be at the hospitals and clinics and
Mm,
doctor surgeries
mm,
that they are actually today.
mm, yeah.
It's a little bit like putting three wheels on a car.
This is Robin Reliant.
I would use the term ambulance, but they're already too slow as it is anyway in the UK, waiting
Yeah, I
an
mean
hour.
that was it. You always guaranteed to get one within what 4 minutes or something at one point, or whatever it was, or 7 minutes. Now, 24
And they're
hours
phoning you
later.
back saying take a taxi.
Yeah. I mean,
Good.
with Uber and everything, I suppose you can, but yeah, depending what your condition is, and but yeah, the idea of the ambulance was that they could stabilize you if
You'd be
something
you'd
hit.
be you'd be a very lucky person if it was an Uber that knocked you over.
I'm just going to say, if they've got an account with the NHS, I think the drivers going around looking. Sorry, I don't want to say anything. Yeah.